back to this channel. We are on a journey to dissect the Everything Babies book. It's a book I've been working on in the past 9 months. It is divided into 7 parts and it's really bulky. Part 1 is caring for your baby. Part 2 is when this thing called sleep. Part 3 is all about feeding babies. Part 4 is harmful Nigerian practices. Part 5 is child development. Part 6 is fatherhood, and part 7 is the spirituality of our kids. In our previous video, we talked about part 1, chapter 1, which was skin to skin contact. In this video, we're going to be talking about part 1, chapter 2, which is umbilical cord care. Stay tuned. Can you remember that long thing that was attached to your baby's belly at birth? That is known as an umbilical cord. I'm sure many parents have been seeing the umbilical cord, but they don't really know what it actually does. What is an umbilical cord and what's its function? The umbilical cord is a tube that connects a mother to her baby during pregnancy. One vein that carries food and oxygen from the placenta to the baby, and 2 arteries that carry waste from the baby back to the placenta. Within a few minutes after birth, a doctor or nurse will clamp the cord and cut it close to the navel. The clamp stops the cord from bleeding. By the time your baby goes home from the hospital, his or her umbilical cord will begin to dry. Now you know the function of an umbilical cord. There are 5 things, according to the Everything Babies book, that I need you to know about the umbilical cord. Number 1, do not pull out the umbilical cord. Although it may seem ideal to help your baby, never pull out the umbilical cord. If the cord is pulled out too soon, it could start actively bleeding, which means there's going to be a continuous flow of blood. The cord is meant to dry on its own and fall off on its own. Your baby doesn't need your help in that way. Number 2, it takes about 7 to 14 days for the umbilical cord to fall off. During this period, there are some things that you can do to help it dry faster and fall off faster. First off, you need to wash your hands. The umbilical cord is very sensitive and you want to ensure that you're being neat around that area. You can use cotton wool or a washcloth. I would advise that you use the cotton wool so you can just use it and dispose it. The washcloth has a tendency of storing bacteria in it. All you need to clean the umbilical stump is warm water, cotton wool or washcloth. That is all. It's that simple. To ensure the water is warm, dip the cotton wool or the washcloth into the water and stroke the umbilical cord gently. Ensure that you're paying attention to the base area, cleaning every single debris there. Take your time, be patient and be gentle, and clean every area of the stump. When you're done, pat the umbilical cord with a dry towel. Allow air to touch it for a bit before you put on your baby's clothes. That is all that is needed for the care of the umbilical cord. Number 3, do not bathe your baby until the umbilical stump has fallen. Now, what do I mean by do not bathe your baby? I mean, do not immerse your baby in water. Your baby should only have sponge baths. What is a sponge bath? A sponge bath is when you use a washcloth and a bowl of water to clean your baby's body. So you're going to dip the washcloth in water, clean their face, their eyes, their ears. Dip the washcloth in water, clean their arms, their folds. Dip the washcloth in water and clean their thighs, clean their bottom. That is what you're going to do for the first 7 to 14 days of their lives until the umbilical stump falls off. You're doing this because you do not want the stump to be soaked in water. We want the stump to fall off quickly. We want it to dry quickly, right? So we need it to stay out of moisture. Once the umbilical stump has fallen off and healed, you can go ahead and immerse your baby in water. Number 4, do not place the umbilical cord in the diaper. Luckily, there's some newborn diapers that keep the umbilical cord out, but if you don't have access to such, simply fold the top of the diaper so that the umbilical stump can be out. We want the umbilical stump to be dry. If the umbilical stump is in the diaper, it's going to come in contact with the fluids there. It's also going to be kept in tightly. We don't want that. We want it to be out. We also need the umbilical cord to be out to prevent infections. Imagine the umbilical cord coming in contact with urine or poo. That is not nice at all. We need it to be safe outside. Last but not the least, you do not need to use methylated spray to clean the umbilical stump. It's unnecessary. My grandma used methylated spray to clean my cousin's umbilical cord. I'm sure she also used it on me, but it's unnecessary. You just need warm water and cotton wool or a washcloth. You do not need to use methylated spray. Also, avoid tight clothing around your baby's stomach. If the umbilical cord is releasing discharge and has a foul smell, you should check with your baby's doctor to ensure that the umbilical cord isn't infected. Pay close attention to the umbilical cord, but don't worry, just ensure that you follow what you've learned in this video and your baby will be fine. You do not want to miss a single episode on this channel, so ensure that you subscribe to this channel and share with other parents as well. Thank you for watching.